Hello everyone and welcome to JCI Miami Chapter 2021 interview series with Keyona Miller. Keyona is graduating 2018 from Our Lady of the Lake University with a master's in social work. Since then, she's worked with diverse populations in private practice, healthcare, outpatient and inpatient treatment settings. She is passionate about mental health and helping others achieve a healthy state of mind. Her expertise is working with evidence-based therapy models such as trauma-focused cognitive behavioral therapy and solution-focused therapy. She plans to open a private practice in the near future to continue to provide therapeutic service to patients. Enjoy our interview. What is the digital transformation and how is impacting mental health global ecosystem?
Digital transformation is the adoption of digital technology by a company.
Interesting.
So basically, it's any sort of technology implemented that enables a business to be more productive, efficient, and effective. Some digital technology tools that most people have heard of is the use of artificial intelligence, robotics, blockchain, and conferencing tools such as Zoom, Microsoft Teams, and Google Meet. Digital transformation has impacted the mental health global ecosystem in many ways, especially since the onset of COVID-19. Many clinicians and mental health agencies have converted to using telehealth to provide therapeutic services to clients. As time goes on, we will continue to see different technologies emerge, such as virtual reality and more complex assessment tools that will help clinicians diagnose patients.
Great insights. What are some of the current trends in mental health?
The first current trend we'll be speaking about is employee mental health and well-being becoming a budget line item in the workplace. According to the data from Kaiser Family Foundation, 36% of adults reported symptoms of anxiety or depression in June 2020 compared to just 11% in June 2019. These effects on mental health can impact retention, productivity, and job performance in the workplace. Due to this, many organizations have recognized the importance of investing in mental health and wellness benefits, such as counseling, self-care days, yoga, mental health resource groups that prevent employee burnout, flexible scheduling, and parent-focused benefits. These are great investments for companies because 53% of employees that work at companies that support wellness feel more motivated than employees without that benefit.
What a great opportunity.
As you can see on this chart, we have the symptoms of anxiety and depressive disorders being drastically increased in just a 3-month span during the COVID pandemic. The next trend we're going to speak about is telehealth and telemedicine. Telehealth basically enables healthcare providers to provide care without an in-person office visit or therapy session. Telehealth is primarily done online through a computer, tablet, or smartphone and is considered a source of telecommunications technology. Thanks to telehealth, individuals across all populations and socioeconomic status have access to cost-efficient mental health care. Overall, telehealth has created a sense of safety, security, and privacy for many patients. Satisfaction and overall experience are also high among patients of all age groups. As you can see in this example, 70% of mental health visits during COVID-19 pandemic were done through telehealth services, and only 30% were done in person. The last mental health trend we will speak about is mental health apps. Mental health apps are gaining traction at an alarming rate. In fact, there are currently over 300,000 health applications in the mobile app stores worldwide. with mental health segment accounting for the largest growth in the market. Mental health apps market is expected to grow at a compound annual growth rate of 20.5% from 2021 to 2027 and reach $3.3 billion by 2027. Two common mental health apps that you may have heard of is Headspace and Calm. As you can see in this Headspace poster, they have reached over 100 million people. It is available in 190 countries around the world, and there are 2,700 enterprises and health plan partners.
It is a very clear indeed answer. But could you mention and describe some of the emerging technologies impacting mental health?
Well, first we'll talk about wearables, which are different devices that are worn on the body. The first wearable is called Muse. Muse is a headband designed to sense the electrical rhythms of the brain. It is combined with a smartphone app to give real-time information about achieving a calm state. The next wearable is called MyBivy. MyBivy is a smartwatch app created for military veterans with PTSD who have night terrors and other sleep difficulties. It collects data regarding various body rhythms during sleep and allows for optional communication of these data to the doctors. Another wearable is called Spiri. Spiri is a small wearable that measures respiration and warns the user when stress levels are going up. We also have Think. Think is a small wearable device for the forehead and is designed to stimulate nerves that signal areas in the brain for increased feelings of well-being. Next, we're going to talk about virtual reality.
This is amazing and unique.
The use of virtual reality is still very new, but it has great potential. Today's virtual reality is primarily designed to aid exposure therapy, which helps patients realize that the threats they are worried about are not actually very dangerous. For example, someone who fears heights might visit progressively taller buildings during their virtual experience under the guidance of their therapist, while someone with PTSD might revisit traumatic memories in therapy sessions.
What are some of the challenges in regards to the adoption of the new emerging technologies in mental health?
The first challenge we will speak about is patient confidentiality issues. The healthcare industry has always been a target for cyber criminals. Patient data is very valuable because it obtains all of the patient personal information, such as their social security number, birthday, and address. Cyber criminals continue to find ways to take advantage of healthcare cybersecurity practices. In recent years, the healthcare industry has seen a 55% increase in cybersecurity threats, turning attacks on healthcare providers into a $13.2 billion industry, making it a gold mine for cyber criminals. The next challenge we'll speak about is the deviation from or the lack of evidence-based practices. Evidence-based practice is a collection of treatment and prevention methods that are based on evidence gathered from scientific studies, evaluations, and practice. In other words, it has to have enough scientific evidence to support it as being effective in producing desired outcomes for mental health therapy. It is vital for practitioners in the mental health field to use evidence-based practice because it brings credibility and reliability to their work with clients and patients. There are many studies that would have to be done to prove that the new technological methods are effective, which can be very time-consuming and expensive. The next challenge is difficulties in regulation. For example, smartphone apps may present many challenges. One of the primary difficulties is the regulation of mental health apps due to their abundance. A number of studies have highlighted evidence of unsafe medical apps. As I mentioned before, there are over 300,000 health applications, and it is growing at a rapid rate.
Could you mention potential solutions that could mitigate the non-adoption of emerging technologies in the mental health industry?
Improving cybersecurity efforts by implementing antivirus software, make patient data available to a limited amount of people, good password hygiene, and constantly upgrading security efforts. We can also ask the government for grants for studies to produce evidence-based practices or offer free trials to patients to collect data. With the smartphone apps, we can have the US Food and Drug Administration, the UK Medicines and Healthcare Product Regulatory Agency, and the England continue to regulate apps, something they've recently started to do since the rule.
Last but not least, Keyona, will you share some of your current projects with our audience?
Right. So as JCI grows, I would like to start different activities that promote mental health, great mental health, like support groups, relaxation activities like yoga and meditation, quotes of the day to provide inspiration, and allow the members to be very involved and help create ideas and activities that we can do.
Thank you very much to our audience. Thank you very much, Keyona. It's a great pleasure to have you with us at JCI Miami Chapter 2021. Interview Serious. See you next time.